Hello, my name is Ruben B. Boer. I am a PhD student in developmental psychology at Liberty University. In this presentation, I will be discussing neurocognitive correlates of pediatric epilepsy, a quantitative analysis of executive function and seizure-related factors among children aged 0 to 17 in Minnesota. The purpose of this study is to examine whether seizure frequency and seizure severity predict impairment in executive function in children aged 0 to 17 living in Minnesota. The variables being studied are seizure frequency, a physiological variable operationally defined by proxy using empathical embrace or EPI monitor, a real-watch device. Executive function measured using scores from the Behavioral Rating Inventory of Executive Function, BRIEF2, and seizure severity measured using the National Hospital Seizure Severity Score, NHS3. By examining seizure-related factors and executive function EF in children 0 to 17 years in Minnesota, this study seeks to advance a dimensional, developmentally informed framework for understanding cognitive risks in pediatric epilepsy. Conceptual framework. This study is based on 4 premises. 1. Epilepsy is associated with deficits in executive function. Systematic review of executive function EF literature shows that children with epilepsy frequently exhibit executive dysfunction despite self-limited seizures. Lopez Santos et al. In 2023 and Gura et al. 2024 demonstrated that children with posterior cortex, frontal, and temporal lobe epilepsies show marked deficits in working memory, processing speed, and other EF domains compared with children of controls and across syndrome. 2. Higher seizure frequency associated with worse cognitive and executive outcomes. Individuals with ongoing seizure perform poorly on memory and show broader cognitive difficulties than those in remission, indicating that persistent seizure activity worsens cognitive outcomes. Review of childhood onset of epilepsy similarly highlight poor seizure control and recurrent episodes as significant risk factors for neuropsychological deficits. This reinforces the idea that higher seizure frequency is associated with more severe cognitive and executive function difficulties. 3. Seizure severity is inversely related to cognitive outcome. Severity indexes that go beyond simple frequency, such as drug-resistant multiple seizure types, also worsen cognition. Aki et al. 2023 showed that greater extension of microglia activation in patients with refractory seizure is associated with lower developmental and cognitive scores. Sinuko and Odismal 2023 reported that children with epilepsy show reduced EF alongside poorer functional mobility, indicating that more clinically complex presentation coincide with broader neurofunctional impairments. 4. The impact of seizure and cognitive functioning is more pronounced in children with epilepsy than in adults. Avian 2022 argued that seizure occurring during childhood interact with ongoing brain maturation, increasing the risk of persistent cognitive and EF difficulties. Empirical pediatric studies show that cognitive and executive difficulties emerge earlier and affect child school achievement and behavior. This developmental vulnerability suggests that comparable seizure burdens have more disruptive, long-lasting neurocognitive consequences when epilepsy begins in childhood than when it first appears in adulthood. Research design and hypothesis. Research design. The current research will use a correlational research design to examine the relationship among seizure frequency, seizure severity, and executive function among children aged 0 to 17 with epilepsy living in Minnesota. Research hypothesis. It is therefore predicted that among children between the ages of 0 and 17 years diagnosed with epilepsy living in Minnesota, there will be a negative correlation between seizure frequency and BRIEF2 scores, as well as between scores of the NHS3 and scores on the BRIEF2. Methods. Participant. A sample size of 138 derived from a G-power a priori correlation analysis will be used. Participant age 0 to 17 with confirmed epilepsy living in Minnesota will be recruited through pediatric neurology clinics, epidemic centers, and epilepsy centers in Minnesota hospital systems. Gender, ethnicity, level of education, or socioeconomic status will not be a basis for exclusion. Participants who complete the study will receive a $10 Target gift card. Apparatus, materials, and procedures. The Empathical Embrace or AP monitor, a wrist-worn device for epilepsy, will be used. This device continuously records physiological signals. It uses algorithm to detect possible generalized convulsive seizure, and it sends alerts to caregivers via a paired smartphone. Here included is an example or a picture of what that device looks like. The NHS3 is a clinically validated semi-structured tool used to quantify seizure severity based on functional impact, physical consequences, and post-seizure recovery. It provides objective, standardized, and reproducible clinical data. It captures seizure characteristics across different seizure types, for example, types 1, 2, 3, and above, and will be administered during clinic visit. The BRIEF2 has 3 standard rating forms, selected depending on age and caregivers. Parent form ages 5 to 18, teacher form ages 5 to 18, self-report form ages 11 to 18. For children younger than 5 years old, clinicians will use BRIEF-P as a preschool. T-scores greater than or equal to 60 indicate impairment, while T-scores greater than or equal to 70 reflect clinically significant executive dysfunction. Procedure. This study will follow institutional approval and data use agreements. Participants will be pre-screened and eligible families will be informed. Written parental consent and child assent will be obtained. All personal data will be de-identified to ensure HIPAA compliance. AP monitor will be used to detect possible convulsive seizures and alert designated caregivers so they can provide timely assistance. Participants will wear the device on their wrist, usually on the non-dormant one. Caregivers or adolescents will use the BRIEF2 publishers Q Global Q interactive system, either in person or remotely. Participants will rate 63 items on a 3-point Likert scale, never, sometimes, or often. Thank you very much for listening to my presentation, and this is a list of my references. Thank you.